Imagine fixing your hip or knee without drugs, without surgery, and only using your cells. Some people come to us with injuries that just require maybe one resource. Maybe it's just PRP. Some people come with a complex issue that requires multiple different biologics. It's our job to evaluate an individual and determine what they really want to accomplish, and then use the actual tools that would be necessary to get them there. When it comes to harvesting stem cells from bone marrow, a lot of people get a little nervous with that, but it's really important to understand that in our body, our bones, it's where our body produces many specialized cells. It's even characterized in the literature as a reservoir for specialized cells that aid in the healing process. So we can go in with a needle and we can harvest as many as we need, and then we can deliver them to the area of injury. And we typically do that in combination with, like I said, various other components, just depending on how it presents and the complexity associated with the condition. Really, the nature of the condition and what the patient wants to accomplish will determine how many times we treat them, whether that be one treatment or multiple, and which tools and resources we use. So for example, like somebody with a meniscus tear right in their knee, depending on, obviously the severity, depending on their age, depending on multiple different factors, their metabolic health, we're basically going to recommend, what would be necessary to get them back to full pain-free, fully functional as quickly as possible. And in many cases, when we have dense structural tissue that's injured like that, it is necessary that we harvest actual stem cells from bone and blood components in the form of traditionally PRP or PRGF, whatever we decide to use for that particular patient, based on a wide variety of factors. So that's really the most important thing. Regenerative medicine is an art and a science, right? And there are hallmarks to what we call orthobiologics. And, it really comes with clinical experience and having the ability to treat multiple patients, thousands of patients really over the last 15 years, to determine what would be necessary for each individual. And we also take into account their overall wellness and their health, and whether or not they have the ability to heal in the first place, and if their cells are actually healthy, and whether or not that's an actual resource that we can utilize. So there's a lot that goes into the recommendations that we make. And, in many cases, we don't necessarily agree to treat certain patients because we know that there's not a very high likelihood that they're going to improve. You may have a lot of questions, and we welcome that. Please comment below or reach out to us.